Prachi. I am working as a Chief Dietitian in Shankara Cancer Hospital and Research Center. Today we will be talking a bit about nutrition and how it is important for cancer patients. So first of all, we should know that the patients who are or the person who is diagnosed with cancer is at risk of getting malnourished. There are many reasons for it because cancer itself is a disease which put a lot of stress or burden on our body, and during the cancer treatment, because of the changes that happen inside our body starts getting weak. Sometimes because of those symptoms, we are not able to have proper food on time. We don't feel hungry, we feel tiredness, we don't have strength to go out and serve for ourselves. Even if somebody is serving for us, we don't have the taste to eat that food, we are not able to relish. And because of the side effect of the treatment, we'll be having depression, our sleep won't be proper, physically we will be tired. So many things are there that contribute to a poor oral intake. So it is very important for the cancer patients to look out for their food or what they are eating, whether they are able to eat in a normal quantity or they are able to eat in a lesser quantity. They have to make sure that whatever food they eat should be nutrient dense. By nutrient dense, what we mean is they have to make sure that they get all sorts of like good carbohydrate, complex carbohydrate, lot of protein in their diet, and lot of minerals and vitamins. So how those macro or micronutrients, that carbohydrate, protein, vitamins and minerals will be available to you or through the food, that a dietitian will help you to find out how you can improve the quality of diet, because quality of diet also will help in improving your quality of life. So if your quality of life during treatment is good, you will be able to sustain treatment better. There won't be any delays. Like if you have a wound, healing will be faster. If you are taking a chemotherapy, radiation therapy or any other therapies, response of the drug to the treatment will be better, because food will help in improving that. So how can we assess our nutrition status during any treatment that we are undergoing? So for that, as a dietitian, how we assess is same things little bit you can apply also. Like we assess the 4 things, ABCD. ABCD is A stands for anthropometric measurement. We look out for height. What is the BMI? For that we need a height and weight of the patient. If patient is losing weight or able to maintain weight, or is he or she gaining weight, if they are gaining weight, what is the reason, whether it is because of the metabolic or hormonal changes, or because their food intake is good, that is leading to good weight gain. So that is mainly, and along with that height and weight and BMI, we check the waist and hip ratio. Waist and hip ratio is also very important indicator. Even it will help you whether you are at risk of developing diabetes or metabolic syndrome or any other non-communicable disease in the future or not. And along with that, B stands for biochemical parameters. So biochemical parameters is your blood parameters, your hemoglobin level, your platelet counts, your neutrophil counts, protein levels in the body, your sodium, potassium, main electrolytes level in the body, calcium, because all the nutrients are important. We just can't look out for 2-3 parameters and say no, you are well nourished or you are malnourished. We have to look out for all your kidney parameters, liver parameters, and make sure that you are able to continue the treatment properly or not. Second, C stands for clinical symptoms. Clinical symptoms include loss of muscle mass. For that we use a hand grip strength. So we tell the patients to check their hand grip strength, because your muscle strength is indicator of telling how able, like what will be the quality of life, because muscle strength is the basic thing now. Because if we don't have a muscle strength, we won't be able to move adequately. In this clinical parameters, muscle strength, whether there is a fat loss or not, how your we check that in this collar region, if your bones are more prominent and compared to how you were earlier, bony prominence is what we call, then it indicates malnutrition. Some patients, they'll lose fat from here, so temporal region, they will be getting black circles, they will be getting puffed eyes, skin color, all that indicates how your nutrition status is. And D is your diet recall. We take the diet recall and we analyze how much your requirements, like based on your whether you're a diseased person or a normal person, how much the basic nutrients your body require, and at present how much you are able to eat or inculcate, digest and absorb. So based on your food intake, we calculate and then tell you the modification, how changes that you should inculcate to improve your diet. So these are the 4 parameters A, B, C, D, how a dietitian will assess you about the nutritional status, and then we can tell you whether you are well nourished, moderately malnourished or severely malnourished. Based on that, our assessment and treatment options also will vary. Now a little bit we can talk about the symptom management. Whatever treatment you are undergoing, whether it's post surgery or during chemo or radiation, some symptoms will overlap, and the common symptoms that a patient faces during any treatment is diarrhea, constipation, dry mouth or lack of taste, what otherwise known as ageusia, vomiting sensation or nausea, and not feeling hungry. These are the common 6 symptoms that a person faces during any treatment that he or she is undergoing. So a few points I'll be talking about how we can manage it at home level. If you face any of these symptoms, what little modification you can do in the diet. So first, if we start with the diarrhea, diarrhea is very common treatment because post surgery patients will be on the antibiotic. So once we take antibiotic, obviously our digestion gets hampered, so we have diarrhea. Sometimes there is a change, like if we undergo a colon surgery, it takes time for the intestine to adjust back to its normal function, so then also diarrhea or constipation can happen. So if diarrhea happens at home, first of all, every time a person goes to a washroom, they have to compensate it with at least 200 ml of liquid. Whatever liquid we consume, in that, first of all, we have to remember that we should add a pinch of salt at least, because every time we go to a washroom or a person has diarrhea, they lose lot of electrolytes like the sodium and the potassium. So other thing we have to remember is, apart from adding salt, they should not consume any milk based liquids, especially plain milk or milkshakes, because they have lot of lactose content. So lactose activates the diarrhea. We can consume buttermilk during that time, tender coconut water with added salt during that time when we have diarrhea. Otherwise, lime juice with added salt and sugar, ganjis we can have, clear vegetable soups we can have, or ORS, electrol. Those are the things that we have to always keep handy at home. So whenever every time a person passes a loose stool or a semi-solid stool, we have to tell them, like, we should compensate. If suppose a person has gone 5 times loose stool, so 5 times or 200, at least 200 ml of liquid they should compensate with added little salt and sugar. And they have to avoid spicy food, because spicy food, if we consume, they increase the movement of the intestine, so the tendency or the frequency of the diarrhea will be more. And they have to go for low fiber foods, the foods which are less in fiber, like for example rice doesn't have much fiber, so instead of going for wheat or millets or ragi during diarrhea, we should consume more of rice based foods, and that too non-spicy and with added salt and like mild flavoring you can do. Second thing is constipation. Constipation is again very common during all 3 modalities of cancer, like post surgery, because of our food intake will be less, so patient lands up into having constipation. The diet will change from clear liquid gradually over a period of 3 to 4 days from clear liquid to then full liquid, then to soft consistency of the food. So there is not much fiber in the diet, so the stools become hard. Moreover, water intake will be less because patients won't be feeling thirsty, so they don't have lot of water or beverages or fluids, so that can contribute to constipation. If we take any painkillers also contribute to constipation. So at home what we can do, we have to include the fiber content in the diet. Like instead of having clear soup, we can boil the vegetables, put it in a mixie or a blender and have it like a unstrained soup. We can have lot of milk based beverages during that time, because again, as I told earlier, milk has lactose and it helps in passing out the motion. We can include milk based beverages, warm milk or milkshake kind of thing, ragi based porridges or ganji, barley, which have more of soluble fiber. Vegetables like the leafy vegetable or the vegetables which have little mucilage, like brinjal or ladyfinger, that also can be included, preferably during the night time, so that it's easy for the person to pass motion during the daytime. And we have to space our meal timings, because if we are not eating on time, again it will contribute to constipation. We have to monitor our sleep pattern and water intake. Along with that, we can get relief of the constipation. And if these remedies are not able to help for diarrhea and constipation, definitely I will suggest to go to the doctor and ask for the medication to get rid of constipation or to control the diarrhea. The other common problem that we face is xerostomia, or the dry mouth, because of the radiation treatment, or again because of some medications and the poor fluid intake. Patients land up into having dry tongue or dry mouth. So for that, what we suggest is to chew any kind of candy, because candy or the chewing gum, they help in improving salivation. So if you are a diabetic, you can go for sugar free chewing gum, because as we chew anything or keep a candy in the mouth, automatically salivation increases. So a little bit mouth will get wet, and instead of drinking lot of water at one stretch, we can make ice cubes, like using filtered water, and keep them in the mouth, keep rolling them, so they also help in keeping our mouth wet. In the food, what we can do is, instead of having dry palyas or chapati, we have to consume foods which are little liquidy or semi-solid in consistency, so that they can form a coating or the layer in the mouth, and the patient won't feel that everything is dry and it is getting stuck to the mouth. Other problem is lack of taste or the bitter taste. I would suggest that we have to include more variety in the diet. Sometimes because of the many myths prevalent that we should not eat this food, that food, patients land up into getting only the bland food with just added salt to it. So if there is already no flavor in the food, fat also, people won't be adding correct amount of fat in the diet. Fat helps us giving us palatability to the food. So fat content in the diet should not be too less also, because it will give flavor. Along with that, ginger, garlic, lemon, coriander, different herbs, fresh herbs or dried herbs can be added to improve the taste. If they are getting a metallic taste, during those days they should not use steel containers or iron containers for cooking and storing the food. During that time, you can use ceramic plates or glass plates or wooden plate. That metallic taste can come down. Now what to do if we have a nausea or vomiting? So nausea and vomiting again is a part of it comes as a side effect, as a part of a treatment. So if a person is suffering from nausea, or what we say is a sensation of vomiting, or you have vomitings also, we have to monitor what to eat, what time we eat, and what temperature and what consistency we eat. If we have a vomiting, we have to we have to analyze that whether we are vomiting the food particles or we are just vomiting the bile or the yellow liquid. So if it is a food that is coming out, then we have to stop eating. We don't have any remedy for that at home, and we have to consult a doctor. If it's just only the yellow color bile or the juices that vomiting it out, then what we can do is we have to first make sure that if we are not able to have solid, we can go for more liquids and increase the frequency. We should not keep like ourselves hungry, or the patient should not keep themselves hungry and saying that, oh, I have a nausea or a vomiting sensation, I will not eat. If you don't eat, that the nausea sensation or vomiting will aggravate. If it's a proper vomiting, then we have to give some time and then retry with either solid or semi-solid food, but it should not be like a fat based or like the deep fried items or a spicy item or citrus juices. We can try for the soft and bland foods like khichdi, curd rice, those kind of thing. If we are not able to have solid food, then some ganjis or cold milk or any beverage which is at room temperature or cold temperature can be tried. Even we have to follow few things same as in diarrhea. Like if we are vomiting many times, we have to add salt and little sugar so that our electrolyte balance can be maintained. If you have lot of vomiting sensation only, there is no vomiting, then you can try adding more ginger or including ginger based candies, because it is proven that the ginger helps in reducing the vomiting sensation or the nausea. Try avoiding food at very hot temperature or very spicy food or any food which has very strong flavor, because they will aggravate your vomiting sensation. Then if you don't feel like eating food, what you have to do is, again there is no instant medication or there is no instant solution that will make you feel hungry. What you have to do, you have to keep trying, but instead of larger meals spaced apart, you have to try small and frequent meals. You can have 6 to 7 meals as what small and frequent meals, but that doesn't mean you have to eat solid food 6 to 8 times a day. What you have to do is take 3 major meals only, but whatever gap is there in between, that we have to replace it with healthier snacks. And we have to make sure that whatever food we are eating, like suppose if we are able to eat only 2 idli, or if a patient is able to eat 2 idli, not able to go beyond that, or not able to eat even 2, able to eat half or 1 idli, attender has to make sure that whatever amount they are able to eat, they have to make it nutrient dense, means it should be high in calorie and the protein and the vitamin content. So for that we have different solutions, like adding nuts paste to the food that we are eating and all can make your food in smaller portion nutrient dense. So if you don't feel hungry, if you are not able to have solids, try with the liquids at least. Liquids you can have after gap of every 2 to 3 hours, but there also we have to make sure that the liquid that we are giving to the patient should be made calorie and protein dense. You can include oral nutrition supplements to provide the nutrients that are missing through the diet. Otherwise, if you are not willing to have that, milkshakes or ganji with added different flavors, or add, as I told, nuts paste added to it, like that we have different modifications that you can consult a dietitian and ask for the modifications, and that will help you in improving your oral intake. Thank you very much. If you have any further queries on how to improve the diet of the patient or how to manage the symptoms at home, you can always contact us. Dietitians are always available in the hospital each like 7 days in a week, from morning 7:30 a.m. to evening 7:30 p.m. If you have any queries, you can call us, you can mail us, or you can personally walk in and ask for the doubts or any queries. We will be happy to help you.